I hope you all had a wonderful experience in the past 2 days of this enlightening international conference on advancing nursing through innovation, research, and digital health. So, as we step into day 3, I welcome you all to this last day of the Global Summit. And we have a remarkable lineup of plenary sessions, a thought provoking panel discussions, and a grand valedictory session awaiting us. So, without further ado, let us commence the proceedings with our first plenary session of the day. Our first session will be chaired by Professor Rosalie Nirmal ma'am. I now invite ma'am on the stage, please. And along with her, I would request our esteemed speaker, Colonel Dr. Binu Sharma ma'am, who will be enlightening us on the topic Empathy and Technology, Human Touch with Digital Solutions in Nursing. And before we begin, I request Dr. Deepti Shukla ma'am to extend a formal welcome by presenting them with a token of appreciation, a life plant symbolizing growth and sustainability. I welcome you on the stage, ma'am. Meanwhile, let me introduce you to our chairperson, ma'am. Ms. Rosalie Nirmal ma'am continues to work as principal at Sahara College of Nursing under KGMU Lucknow. Her professional qualifications include an MSc in Obstetric and Gynecological Nursing from Chaitram College of Nursing, Indore, DAVV Indore, where she secured the first rank in her MSc Nursing program. Ma'am also has a general nursing and midwifery degree obtained from Kurji Holy Family Hospital, Patna. She later pursued a post-basic BSc Nursing from Dhamtari Christian College, Raipur. Her professional journey began at Holy Family Hospital, Patna, where she served from 1989 to 2005 in various roles including clinical nurse, ward in charge, clinical instructor, and nursing tutor. During this time, 12 years were dedicated to the labor room, gaining extensive hands-on experience in maternal and newborn care. She was appointed vice principal at Sahara College of Nursing, where she served until 2017, after which she was promoted to principal's post. In addition to her academic leadership, she has been actively engaged as a speaker and resource person for various national conferences. Ma'am has served as an external examiner for several prestigious universities, including BHU Varanasi, IGIMS Patna, DAVV Indore, and CSJM Kanpur. Thank you. Now I request Professor Rosalie Nirmal ma'am to kindly come up the stage and introduce our distinguished speaker, Colonel Dr. Binu Sharma ma'am.
Very good morning to all the respected dignitaries, delegates, speakers of the day, and definitely to all the students who were staying here for 3 days to attend this conference to get some insights into nursing profession as well as the topic which was innovation, research and digital nursing or digital healthcare. So I am humbled, honored and privileged to welcome an eminent nursing leader, Dr. Colonel Binu Sharma ma'am. Her commitment, dedication and determination towards nursing profession is not commendable. No words can explain what she deserves and what she expects from the nursing profession. So without any other introduction, let me start with introducing Dr. Colonel Binu Verma ma'am. Colonel Binu Sharma ma'am, I am so sorry. With over 4 decades of distinguished service in the field of nursing, Ma'am has made a remarkable contribution in both the armed forces and the private health sector. Having served in critical care and nursing administration across renowned healthcare institutions, she has played a pivotal role in shaping nursing policies, training programs, and patient safety protocol. Awards and achievement. Her leadership has been recognized through numerous prestigious awards, including the Nightingale Award for Nursing Leadership, the Woman of Excellence Award, and the Topmost Healthcare Leader Award by the World Health Congress. Ma'am has served as the President of the Infusion Nursing Society India and also act as an advisor to several national and international healthcare bodies. She had led an initiative to establish best practices, develop skilling modules, and implement the INFUSC certification for hospital quality improvement. Her expertise has been widely shaped through publications, conferences, presentations, and webinars, making her a respected voice in the healthcare community. During the COVID-19 pandemic, she guided nursing team across Columbia Asia hospitals, implemented SOPs, ensured staff welfare, and spearheaded training programs that benefited over 1.2 lakh nurses. And her membership, a certified NABH assessor and a member of the advisory panel at FICCI for national nursing reforms, she continues to drive excellence in nursing leadership, training, and patient care. A founder member of the founder member of the Association of Nurses Executives India, she continues to drive nursing empowerment and healthcare advancement nationwide. So let us welcome ma'am for the insightful subject, that is empathy and telehealth.
Thank you everyone. Welcome. मैंने तो भेजा हुआ है डॉक्टर दीप्ति को भी भेजा हुआ है. Namaskar everyone. Thank you Professor Rosalie from the Max College of Nursing for a very humble and a very lengthy introduction. I welcome the delegates, the students, the faculty, and esteemed members in the auditorium. It's a moment of pride for me to be part of this conference, and the theme is very impressive. I wrote to Dr. Deepti, what a theme. And out of that theme, a fantastic topic given to me, a unique combination of empathy and digitalization. I do not know if the students who are largely in number as audience, can they appreciate the fact that empathy and digitalization or technology, can they marry each other without a divorce? Is that possible? Empathy एक तरफ है, technology दूसरी तरफ है. 48 years back when I started nursing, 1977 I entered nursing through Indian Navy. And that time we had zero technology, no digitalization, no social media. The only thing what we had was empathy, compassion, high touch. While they are putting up my presentation, I'm filling the gap and setting the context because I think some technology issues in you've done it? All right. So he's done it, that's efficiency. So from a word of compassion and empathy, way back 40 years ago, in last 20 years, or I would say close to 15 to 20 years, we have moved to the world of technology. So let's see in the next few minutes, how can these two work together, not divorcing each other, but complementing each other and leading a fantastic life and progressing in patient care. So over to my presentation. Down, okay. So this is one, you have a hand mic? Can you give me that? I don't like to stand. Okay. So this is one of the amusing stuff I have put. Nurse, can you hold my hand? I'm very nervous. That's the patient. The nurse of today's time. Of course, let me submit a request, sir. That may take 3 to 5 working days. Is that the technology? One more. Nurse, I'm feeling really scared today. I understand. I understand is part of empathy. Let me update your fear level in the system, and would you please rate it mild, moderate, or severe? More than the pain, she is worried about the technology. She is not looking at the patient. There is no eye contact. She is looking at her tablet. That is what is technology. Is that so? Okay. Empathy. Empathy is the core care of nursing. Whether we go back 100 years ago, we go back to times of the lady with the lamp, Miss Florence Nightingale, who started her journey with compassion and empathy, caring for the soldiers. She was from wealthy, rich patients. She chose the profession because she wanted to serve. So empathy started there and has been into practice in nursing always, yesterday, today, and empathy is here to stay. So this is the core value of nursing. Defining empathy. What is empathy? Empathy is not sympathy. It is different. Empathy is putting oneself in the shoes of the patient to understand his clinical and emotional needs. The definition of empathy is very simple. Feeling like the patient is feeling. If the patient is having pain, you don't have to sympathize with his pain saying, I'm sorry, but you need to understand what he is going through, what support he needs in terms of pain medications, and what he needs emotionally as reassurance because he is having pain. Impact on patient care. When you do all clinical activities loaded with empathy and compassion, it enhances clinical outcomes, it improves patient satisfaction, it also establishes a trust, a mutual respect, and a rapport with the patient. It reduces distress, anxiety right away. It strengthens the communication between a nurse and a patient, and also between the nurse and every other member of the patient family. And how can a nurse demonstrate empathy? What is her role there? So, active listening to patient needs. An important part of empathy is actively listening to the patient, understanding verbal and non-verbal cues. At times when patients are in distress, are depressed, they do not communicate. There's no verbal communication. But patient is looking upset. Patient is looking angry, maybe depressed. The nurse who is empathetic should be able to understand his non-verbal communication, the body language. Patient is lying withdrawn, not even looking at the nurse. Providing emotional support and reassurance, respecting cultural and personal values, and advocating for patients' needs with dignity, keeping his privacy, confidentiality, hence maintaining the dignity of the patient. This is how a nurse should understand empathy and demonstrate or practice empathy. I hope all of you are okay with English. कहीं बीच में हिंदी में बोलना, I'm okay with it. I speak very good हिंदी. बता सकते हैं आप लोग. ये एक empathy orbit है. I googled it and found this very something new to put across for the audience. So there are things from regret to compassion in the framework of empathy. Regret is, I really feel sorry for you. A patient diagnosed with cancer, if a nurse or a doctor says, I feel sorry for you, the patient and family will also feel sorry. Sorry is not going to resolve. Next is sympathy. I understand. So sorry, poor thing. this patient has got cancer, is kind of sympathy element. Then it goes to empathy, I hear you, and it goes to compassion. Sir, I understand what you are going through. This is how the empathy orbit shapes up. So, healthcare professionals, especially nurses, need to understand how they have to design compassion and empathy in their interaction with patient, in their communication with patient, in the care when they are managing patients. Okay, we understood empathy. Now comes my second part of the topic. What is technology? You all know technology. Gen Z is on social media, Twitter, LinkedIn, Google, Facebook, Instagram. They understand technology. In fact, the people who are 40 or 50 or who belong to my age may find technology more cumbersome. I say that with experience. When we launch any new technology platform, I represent Max Healthcare. Anything new done in technology, a new digital app for patients, for doctors, a new hospital information system, a barcode management system, inventory management system, technology solutions, people's mind is closed. जो पुराने टाइम के डॉक्टर्स हैं बोलते हैं मैडम ये क्या करवा रहे हो, पेपर पे लिखवा लो, हम तो सालों से पेपर पे प्रिस्क्रिप्शन लिखते रहे हैं, कोई गड़बड़ नहीं होती. So technology, you guys are more open to technology. Today's generation wants technology. So let's see what is technology. Technology क्या करेगी हमारे लिए हेल्थ केयर में? Better patient care, improved care delivery. I can endorse by this statement. रिमोट पेशेंट मॉनिटरिंग सिस्टम्स, पेशेंट घर में होता है उसकी रिमोट मॉनिटरिंग हो सकती है. आप एक ऑफिस में एक हॉस्पिटल में बैठ के उसका मॉनिटर, उसके वाइटल पैरामीटर्स, उसके अलार्मिंग पॉइंट्स यू कैन चेक सिटिंग इन द हॉस्पिटल. पेशेंट मे बी 100 miles away. Enhanced patient education. Suppose a patient is going to go for a heart surgery, cardiothoracic surgery. पहले हम कैसे करते थे एजुकेशन? हम कुछ पेपर होता था, वी विल रीड दैट एंड एक्सप्लेन टू द पेशेंट. यू कैन शो ए सर्जरी ऑन योर स्मार्टफोन or a smart tablet. Tell the patient, sir, pre-operatively this is what it will be on the OT table, surgery will be done, it will take this much time, this is your heart diagram, exactly here the surgery will be done, the valve will be replaced. You can do a better quality and evidence-based patient education. Efficient healthcare analysis. All the data what you get through technology platforms can easily be analyzed. Access to real-time healthcare information. If a patient just came to the hospital, he has booked himself through a patient app. We've got a patient app in our organization. He can book. He just enters the hospital premises. The app will give a notification. You are here right now. Turn on your left, you will find the cardiac OPD. He goes there. His vitals are done. Everything is very easy. The data is real time available. Leave alone hospitals. You travel by air. Your app, the Digi Yatra, it tells you where to go, which gate to take on. Everything is digital. And you don't have to show your Aadhaar card, ID proof. Nothing is needed in today's time. Timely assistant and preventive care, a very important part of technology help. It minimizes or eliminates human error. When you write with hand, there can be errors in transcription, in writing, in understanding the handwriting. हम सबको पता है डॉक्टर्स बहुत बिजी होते हैं, उनकी हैंडराइटिंग थोड़े टाइम के बाद उनको भी समझ में नहीं आती. So nurses, how will they understand? Technology will minimize and eliminate those important errors. Privacy and security of data, yes, technology will provide you a proper data management system. I saw a topic on health informatics, I think, today sometimes. Okay. So what happened? कहाँ से आई टेक्नोलॉजी और कब आ गई हमारे वर्ड में टेक्नोलॉजी? अभी तो नहीं आई. It started long time back. So let me read. Somewhere in 1950s, we didn't have much technology. We had the basic mercury thermometer, we had the stethoscope, the BP instrument, we had X-ray, IV set, some very primitive, very basic set of antibiotics. That was all we had in technology. I'm mentioning of healthcare. Then we moved to 1960, 1980. 1960 I was born, and 80 I completed my nursing. Cardiac monitors, ventilators, ICU care, defibrillator, ये सब तब शुरू हुआ. उन दिनों में भी we did not have IV cannulas, we did not have robos, we did not have laparoscopy, we did not have many things. Then what happened? 1990 to 2000, we had further technology advancement. Barcode medication administration system, उसको BCMA बोलते हैं. We practice BCMA. It is an outstanding tool for patient safety, medication safety. Electronic health record, सारे health record आपको कंप्यूटर में मिल जाएंगे. Paper records are not needed anymore. Smart infusion pump for delivering infusion therapy, mobile nursing stations, computer on wheels, ये तब शुरू हुआ. Moving further, 2010 onwards, robotics happened in healthcare. Robotics had transformed the entire way we function in the hospital. Right from the operating room, अभी तो हॉस्पिटल्स में रोबोज आपकी मेडिसिन और सप्लाईज लेके आते हैं, बायोमेडिकल वेस्ट लेके जाते हैं, लिनन लॉन्ड्री लेके आते हैं. यू कैन फाइंड रोबोज, एक 4-wheeled ट्रॉली जस्ट लिटिल शॉर्ट ऑफ माई हाइट, वो घूमती रहती है लॉबीज में. बहुत सारे हॉस्पिटल में, आई सॉ ए हॉस्पिटल in US, California. It was wonderful to see robots doing all the work which otherwise other people do in the hospital. That is technology. Then moving on in today's time, artificial intelligence powered virtual nurses, blockchain technology, nanotechnology, automated infusion systems. आजकल तो you can't think what is available in technology in healthcare. So all the people who are in final year, second year, who are just going to be registered nurses, you have a fantastic era ahead of you in terms of healthcare technology. Your life is going to be simple. अगर आपको दीप्ति मैडम बोलते हैं कि एक प्रेजेंटेशन बनाइए मेडिकेशन मैनेजमेंट पे, चैट जीपीटी को बोलिए प्लीज गिव मी ए प्रेजेंटेशन ऑन मेडिकेशन मैनेजमेंट, यू विल गेट 20, 30, 50 स्लाइड्स, एज मनी एज यू वांट. दिमाग खुद लगाना पड़ेगा इसमें से क्या चूज करना है, बट आपको वहां पे मैटर मिल जाएगा. ओके, दिस इज ए पैराडिम शिफ्ट इन हेल्थ केयर around the topic of empathy and technology. So 1990 we had high touch. We were always with the patient, talking to patient, reassuring, spending time. High touch, low technology. It was a physician or doctor centric healthcare. Then came the shift completely. Now we are low touch because technology बढ़ गई है. We are low touch, high technology. Now it is a patient-centric healthcare system. This is the shift in last 30 years. High technology or high tech in healthcare has taken us away from the patient. We are spending more time on monitors, computers, analytics and all of that. Technology in healthcare, is it a good thing to have or is it a chaos to have? So let us see what is the boon or what is the bane. The positives, definitely faster and accurate diagnosis, remote healthcare access has reduced errors, increased efficiency. For everything happens faster. The downside, lack of human touch, we are not having time and also intent to spend with the patient. Over reliance on technology sometimes may lead to cyber attacks, data privacy issues. Hospitals keep having those attacks, and sometimes human beings fear that technology will take over the humans, हमारी jobs चली जाएंगी, which is not true. The empathy gap, a critical challenge. These are some of the studies which have shown clearly that technology has reduced a nurse patient time. A time motion study done way back in nursing scholarships found that nurses who used EHR spent less time at the patient's bedside. Similar way, another study shows less communication between the nurse and the patient and family and reduced face-to-face interaction. Patient will ring a bell. The nurse will give a call to the patient. सर आपको क्या चाहिए? अच्छा आपका बेड ऊपर करना है सर, वहाँ पे एक रिमोट है, आप बेड ऊपर कर लीजिए, हो जाएगा. This is what technology is doing in healthcare. Challenges of merging technology with nursing. Screen time versus human interaction. When you are busy putting the data and the stats on a computer, आप पेशेंट की तरफ नहीं देख रहे हो, उससे बात नहीं कर रहे हो. You are spending less time, you are doing less communication, you are not even spending time in the history. So many of your previous data from technology is giving you the history. Training and adaptation takes time, as I said. Many of these senior healthcare professionals, doctors, nurses, they need a lot of training to adopt technology, and privacy concerns can happen in technology. The big question, how can we leverage technology to enhance empathy? Technology से empathy कैसे हम improve कर सकते हैं rather than reducing it? Can that happen? Solution, empathy driven technology. From a time of technopathy, technology and no empathy, we can move to empathy driven technology. That is very much possible, and that is what we need in the future years, in the future time. All of you who are going to be licensed or registered nurses in a very short time, please understand empathy will continue to be a critical part of patient care, because nursing is a unique combination of the art of empathy and compassion and the science of skill and technology. Care tech, a synergetic approach to patient care. Compassionate communication, you need to ensure that. Adaptive assistant, मतलब आपके पास आजकल स्मार्ट सॉल्यूशन ड्रिवन व्हील चेयर, स्ट्रेचर्स, पेशेंट बेड्स, इन्फ्यूजन सिस्टम्स टेक हेल्प ऑफ टेक्नोलॉजी to reduce your time and effort. Responsive care to the patient. Ethical engagement with technology as well as with patient. Technology integration in everything you do. Education and empowerment and a collaborative care where technology plays its role, human interaction plays its role. All the departments come together for a multifaceted approach in terms of patient care. So it's a time of human touch which will continue. It is never going to go away, whatever could be advancements in technology. Compassionate communication, it is something on priority. A nurse-patient connection and communication must always be there. Use language which a patient understands, which has a lot of kindness exhibited. Also use body language, kind gestures when you are not speaking. Balance technology and empathy in every aspect of care. Actively listen to the patient concern. Spend time at the patient's bedside. Care tech, a synergetic approach. Okay. Alright, compassionate communication we just completed. Adaptive assistance is utilize assistive technologies to reduce your time in care, make care more simplified, yet keeping empathy with you. Leverage real-time data for timely interventions. इसका मैं आपको एग्जाम्पल देती हूँ. फॉर एग्जाम्पल आपने पेशेंट को रिमोट डिवाइस पे लगाया है पेशेंट के रूम में ऑन ए फ्लोर, and you are getting patient's vital signs, saturation and other parameters at the nursing station on a monitor screen. ये होता है, रियल टाइम में हो रहा है. आपको उससे देखना है where the patient's heart rate is going up. Is it coming down? Is it an alarming sign? That will help you to go to the patient room on time and check the patient, speak to the patient, monitor and evaluate the patient properly. This is what it will help you. Real-time data and predictive analysis will help you to take action faster for a code blue or a rapid response to the patient in terms a patient is going to crash, not after a patient has crashed. Ethical engagement, ensuring technology is used ethically. The solutions you keep in the hospital are properly verified with data privacy. Respect dignity of the patient. Implement all technology solutions for seamless patient care, reducing nursing time in tough activities so that they have more time to spend at the patient bedside. Education, empowerment, and collaborative care. Educate nurses to be empowered to take patient care decisions. Collaborative care, as I said, between all team members, doctors, dietitian, physiotherapists, nurses, patient families, all together should work for a single goal: patient satisfaction and patient safety. Ensure technology complements, not replaces, and there is a personal touch. Maintain a balance between human empathy, which drives decisions, supported by technology. Digital empathy कुछ हो सकता है when we do video call, video consult, when we do online conversation with the patient. That is digital empathy. In those communication and interaction also, empathy and compassion must be maintained. So active digital listening, communication, your body gestures in a video call. This is a video. I hope it works. Can you please check that? Hello, hello, hello. This is a video. Can you ensure this sound? A small video on empathy. And that is my last slide. Just click. Next. Just click on that, the mouse. You'll be able to play. Yeah. hear what they hear, see what they see. There is patience. That is empathy, ladies and gentlemen. So, technology should simplify our work to free up more time to spend empathetically at the patient's bedside. Thank you very much.
That was truly an insightful session. Thank you, Dr. Beenu Sharma ma'am, for sharing your valuable knowledge. I now invite Professor Rosalie Nirmal ma'am to share your feedback on this session.
I was truly speechless watching that last clip, the video which ma'am shared. It was truly touching, ma'am. I don't know, I could not control my eyes without tear. And that last clip said everything about empathy and what is our role being a nurse in someone else's life. Ma'am has discussed whatever it is because it was a very insightful learning session and I really took many things. Many points. I really appreciate ma'am for sharing those session and it was really worth listening to that particular session. And I could say the audience was very silent. Otherwise they used to talk in between. But they were listening to ma'am's topic. It seems everybody was interested to learn something related to empathy. So like ma'am said, integrating technology with empathy. We cannot take one away from that because this present scenario, like we say education and practice, nursing practice. Same way, empathy and technology, it goes together and we cannot take it, separate it. So integrate it to deliver the holistic nursing care to the humanity. And don't forget the human touch in your nursing care, in your professional life. Thank you, ma'am. Thank you so much for the insightful and knowledgeable, meaningful session. Thank you so much, ma'am. I have no words to say because I was so emotional watching that video. Really, ma'am. Thank you, ma'am.
Thank you, ma'am, for your valuable words. I now call upon the stage Dr. Deepti Shukla, ma'am, to felicitate our honorable chairperson and speaker with a memento as a token of gratitude.
I would like to have two more people from Max Associate Lakshmi Pandey and CNO, Max Group Lucknow. It's all Max.